Hi everyone, I'm Arturo Hurtado, Senior Manager of Clinical Research at the HealthTree Foundation, and I'm here at IMS, the International Myeloma Society Conference, presenting one of the abstracts that we've been working with Dr. Ola Langren from the University of Miami, looking into the MRD perceptions of outcomes and the use of MRD negativity as an endpoint that recently changed by the FDA. So during this survey, we wanted to understand first the perspective around MRD. And one of the key questions that we keep hearing during this conference is if patients would change treatments or pursue discussions with their care teams just around getting to an MRD negative state. And from our survey, the patients showed around 46% of them would be likely to discuss these changes. So that's one of the key questions that we wanted to ask. And around clinical trials, we wanted to understand the perspective around the use of MRD negativity. And around 77% of them showed a high value of MRD negativity as being used for these kind of clinical trials. They show that they would likely to rate a clinical trial higher if it has high rates of MRD negativity and sustained MRD as well, and would probably rate it around average or below average if after 2 months it showed a lack of sustained MRD. So patients are highly educated around MRD negativity, and we wanted to see their perspective around the changes the FDA did a couple months ago around using MRD negativity as a key endpoint for clinical trials. And surprisingly, 90% of the patients rated these issues as important, highly aligned with what they knew already. So patients were already aware around these kind of decisions. Now, after we share a summary paragraphs explaining what the FDA chose to do, it bumped up to 97%. So patients we know are highly interested in MRD negativity as a key endpoint, not only in clinical trials, but also in the general care practice. Thank you.